widespread testing, when currently, out of the 500,000 NHS staff, we think around 5%, 1 in 20 NHS staff have been tested. I personally have had symptoms, have had to self-isolate, and then come back to work without ever having a test. And I'm by no means alone in that situation. So, without widespread testing, we don't know where the disease is, we can't act appropriately. And how does one come out of lockdown then without triggering, again, another rise? And we're barely plateauing, but still with very, very many deaths. It's not even certain we've reached the worst point. And to come out of this, we need to go back to the straightforward health measures of testing, of isolation, of contact tracing, and protecting the population. It's clear that we haven't done that. And precisely when we're having promises that PPE will be delivered, but it's not delivered, then the hospital staff are vulnerable. Then infections can't be limited within our NHS, within our state of our hospitals, which, as we talked about before, are at huge overcapacity. In the late 80s, Britain had over 300,000 hospital beds. Today, we have, going into the crisis, we had less than 140,000 beds. There's a drop of over half in 20, 30 years. And that wasn't just because of increase in technology, day surgery, all the rest. It was a deliberate policy to cut it. We have one of the lowest bed rates. So we have a low capacity rate. We have 6 ITU beds per 100,000 of the population. The way we've expanded those ventilators from the 4,000 we normally have up getting towards 10,000 is mainly by decommissioning everything that we do in theatres and using those theatre ventilators, which are not really designed for long-term ventilation of ITU patients, but we're using them. And very slowly, we're having, in dribs and drabs, a few come here and there, allegedly some going to the Nightingale Hospital, but really the entire effort to deal with coronavirus has been marked by failure after failure, reassurance after reassurance, upon which very little has been delivered.